Good day everyone, we are here to discuss about the process and hazards to prenatal development. Did you know when does human life begins? It begins at the term conception. Conception is the union of the male sperm and the female egg cell to form a new organism. As this conception develops, it undergoes the stages of prenatal development, which is divided into three periods. First is the germinal period, second is the embryonic period, and third is the fetal period. So moving on to the germinal period.
The germinal period includes the creation of the zygote, the continued cell division, and the attachment of the zygote to the uterine wall. And also, germinal period includes rapid cell division, and by the end of the stage, the fertilized egg becomes a blastocyst and plants itself in the wall of the uterus.
So we're here at the second stage of the prenatal development, which is the embryonic period. Embryonic period happens 2 to 8 weeks after conception. Here, the zygote becomes the embryo. Here also, the cell differentiation intensifies. The life support systems for the embryo develop, and organs are slowly appearing. At the first month in the embryonic period, the embryo is 1/4 inch in length. Heart, digestive system, backbone, and spinal cord begins to form. The placenta, or sometimes called after birth, begins developing, and the single fertilized egg is now 10 times longer than size at conception. So we can see here the embryo developing slowly from 6 weeks to 7 weeks and to 8 weeks. You can see that we can slowly distinguish the eyes, the hands, and other parts of the baby. So at the end of the 8 weeks, the embryo is 1 1/8 inches in length. The eyes, nose, lips, tongue, ears, and teeth are forming. The embryo is moving, although the mother cannot yet feel the movement. And also the heart is functioning. The process organogenesis is also part in the embryonic period. This is the organ formation during the first 2 months of the prenatal baby. As you can see here, it has 3 layers: the endoderm, the mesoderm, and the ectoderm. The endoderm, or the internal layer, consists of the lung cells, or the alveolar cells, thyroid cells, digestive cells, or the pancreatic cells. In the middle layer, which is the mesoderm, here consists of cardiac muscle cells, skeletal muscle cells, tubule cells of the kidney, red blood cells, and the smooth muscle cells, or in the gut. And the last layer, or the external layer, which is the ectoderm, here consists of skin cells of epidermis, neuron of the brain, and the pigment cells. So as these 3 layers form, the endoderm, the ectoderm, and the mesoderm, the support system for the embryo develop rapidly, which are the placenta, umbilical cord, and the amnion. So here you can see the placenta. It is an organ that develops in the uterus during pregnancy. The structure provides oxygen and nutrients to a growing baby. It also removes waste products from the baby's blood. The placenta attaches to the wall of the uterus, and the baby's umbilical cord arises from it. So speaking of umbilical cord, it is a tube that connects you to your baby during pregnancy, meaning you is the mother. It has 3 blood vessels, 1 vein that carries food and oxygen from the placenta to your baby, and 2 arteries that carries waste from the mother to the baby back to the placenta. And lastly, the amnion is a thin-walled sac that surrounds and protects the fetus during pregnancy. So moving on to the last stage of prenatal development, the fetal stage.
The fetal period, month 3, week 9 through 12. The hands, feet, fingers, and toes are fully developed. The fetus is currently beginning to explore a little by opening and choosing its lips and face. And external ears are forming, and fingernails and toenails are starting to grow. Under the gums, teeth are starting to erupt. The reproductive organs also grow, but ultrasonography still has trouble differentiating between sexes. The fetus is fully formed by the third month's conclusion. Every organ and line extremity is present and will continue to grow and develop until it is ready to function. Additionally, functioning are the urinary and circulatory system, and the liver creates bath. The third month came to a conclusion. Next is month 5, week 17 through 20. You might feel the fetus moving around at this point. The developing fetus is working out its muscles. This initial motion, known as quickening, can resemble a flutter. The head starts to sprout hair. A silky fine hair called lanugo covers the shoulders, back, and temples. This hair shades at the end of your baby's first week of the life serves to safeguard the fetus. The vernix caseosa, a whitish covering, covers the skin. It is believed that this cheesy material shields the embryonic skin from prolonged contact with amniotic fluid. Just before giving birth, this coating is lost. The fetus is roughly 10 weeks along by the end of the 5th month. Next is month 6, weeks 21 through 24. Right now, if you could peek inside the uterus, you would observe that the fetus skin is translucent, piglet, and reddish in color. The toe and finger marks can be seen. The eyelids start to separate at this point. At the eyes start to open. The fetus moves or quickness its heartbeat in response to sound. The fetus measures if it experiences heartburn. If given extensive care, a premature baby will live past the 23rd week. The fetus is around 12 inches long and weighs about 2 pounds by the end of the 6th month. Next, month 7, weeks 25 through 28. The fetus keeps growing and accumulating bodily fat stores. The development of hearing is complete at this time. The fetus frequently shifts position and reacts to stimuli including light, pain, and sound. Amniotic fluid starts to get thinner. Your kid would probably live after the 7th month if it were to be born prematurely. The fetus is between 2 and 4 pounds and around 14 inches long at the end of the 7th month. Trimester 3, the last stage of the pregnancy. The last month 9, weeks 32 through 36. The fetus continues to develop and expand at this period. At this stage, the lungs are almost finished developing. The fetus can blink, close its eyes, turn its head, grab something firmly, and react to sound, light, and touch thanks to its synchronized reflexes. The fetus measures between 17 and 19 inches and weighs between 5 and 6 pounds.
Let us now look at teratology and other potential dangers to prenatal development. So what is teratology and what is teratogen and what is the difference between the two? So first and foremost, let us discuss the teratology. What exactly is teratology? Teratology is derived from the Greek noun teras, which means monsters, and has historically referred to the study of malformations in early life caused by the chemical exposure such as mercury, lead, and other complex compounds. It is the study of the causes of congenital or birth defects. What exactly is a teratogen? A teratogen is something that can cause or increase the risk of a baby having a birth defect. They are substances to which a mother may be exposed during her pregnancy. Some medicine are teratogens, drugs on the street. Some medications, recreational drugs, tobacco products, chemicals, alcohol, certain infections, and in some cases, uncontrolled health problems in the birthing parent are common teratogens. Alcohol is a well-known teratogen that can cause harm to the fetus if consumed at any point during pregnancy. So now, let's proceed to the cluster of hazards to prenatal development. So what are those hazards to prenatal development? Number 1. Prescriptions and non-prescription drugs. The term prescriptions refers to medicines that are safe and effective when used under a doctor's care, whereas non-prescriptions or OTC drugs are medicines the FDA determines are safe and effective for use without a doctor's prescription. So what is the difference between these two? Prescribed medication is the medicine that you can only have if the doctor has given you a prescription for it, such as antibiotics or streptomycin and tetracycline. Non-prescribed medication is medicine that you can buy over the counter from the chemist or pharmacist. For example, aspirin or ascomycin. That is why it is not advisable for pregnant women to take medication without their doctor's or OB/GYN's permission. So now, psychoactive drugs. These are drugs that act on the nervous system to alter states of consciousness, modify perceptions, and change moods. Nicotine, it preterms birth, lowered weights, fetal and neonatal deaths, respiratory problems, and sudden infant death syndrome. What are examples of nicotine? Products such as cigarettes, cigars, pipe tobacco, chewing tobacco, and wet and dry snuff, and the dry leaves from the tobacco plant all contain nicotine. Electronic cigarettes, also known as vapes, do not contain dry tobacco leaves, but they may still have or contain nicotine. So, alcohol, it can cause fetal alcohol spectrum disorders, and also it can increase the risk of miscarriage, premature birth, and your baby having a low birth weight. It can also affect your baby after they born. Caffeine increase the risk of miscarriage. The researcher noted that caffeine is believed to cause blood vessels in the uterus and placenta to constrict, which could reduce the blood supply to the fetus and inhibit growth. Cocaine and methamphetamine. High rates of infant mortality, low birth weight, and developmental and behavioral problems, while marijuana and heroin lower intelligence in children and causes ADHD.
Environmental hazard is a state of events which greatly affect the surrounding and people's health. Example of environmental hazard, the first one is increasing harmful gases at home and at work, and second, soil-related helminths, toxic and radioactive waste, and last, water-related diseases, childhood, diarrhea, hepatitis, typhoid, schistosomiasis. Radiation, toxic wastes, carbon monoxide, mercury, lead, coal ash, certain chemicals, and herbicides. Radiations is a type of energy that travels through the air and can penetrate solid objects. It is present in our environment all the time, both naturally and as a result of human activity. Exposure to high levels of radiation can cause serious health effects, including cancer. It can also lead to death. There are two main types of radiation: ionizing and non-ionizing. Ionizing radiation is the more dangerous types. It can damage cells and DNA, causing cancer. Non-ionizing radiations is less harmful but can still cause health problems. Toxic waste is a potential dangerous byproduct of a wide range of activities. including manufacturing, farming, water treatment systems, constructions, automotive garage, laboratories, hospitals, and other industries. Maternal disease. Maternal illnesses increase the chance that a baby will be born with a birth defect or have a chronic health problem. Some of diseases that are known to potentially harm the fetus include diabetes, cytomegalovirus, toxoplasmosis, rubella, varicella, hypothyroidism, and strep B. If the pregnant woman contracts rubella during the first 3 months of pregnancy, damage can occur in the eyes, ears, heart, or brain of the developing fetus. On a positive note, rubella has been nearly eliminated in the industrial world due to a vaccine created in 1969, diagnosing these diseases early and receiving appropriate medical can help improve the outcomes. Routine prenatal care now includes screening for gestational diabetes and strep B. Syphilis, a sexually transmitted infections, and genital herpes. AIDS is sexually transmitted infection that is caused by the human immunodeficiency virus or HIV, which destroy the body's immune system. A mother can affect her offspring with HIV or AIDS in these ways. The first one is during gestation across the placenta. The second one is during delivery through contact with maternal blood or fluids. And the last one is postpartum after birth through breastfeeding. Maternal malnutrition. What causes malnutrition during pregnancy? Fetal undernutrition can occur because of an inadequate maternal diet, inability of the mother to mobilize and transport sufficient nutrition, or an impaired vascular and placental supply line to the fetus. It can also occur if there are high fetal demand, for example because of a faster growth. Folic acid. This vitamins is needed to make blood cells and new tissue. During pregnancy, you need more folic acid. Lack of folic acid has been linked and neural tubes defects or NTDs are abnormalities that can occur in the brain, spinal cord, or spine of a developing fetus. Folic acid. This vitamins is needed to make blood cells and new tissue. During pregnancy, you need more folic acid. Lack of folic acid has been linked with neural tube birth defects such as spina bifida. Open NTDs occur when the brain and or spinal cord are exposed at birth through a defect in the skull or vertebrae backbones. NTDs occur when the neural tubes does not close properly. The neural tube forms the early brain and spine. These types of birth defects develop very early during pregnancy, often before a woman knows she is pregnant. The two most common NTDs are spina bifida, a spinal cord defect, and anencephaly, a brain defect. Encephalocele is a rare type of birth defect of the neural tube that affects the brain. The neural tube is a narrow channel that folds and closes during the 3rd and 4th weeks of pregnancy to form the brain and spinal cord. Encephalocele happens when the neural tube does not close completely during pregnancy. The result is opening anywhere along the center of the skull from the nose to the back end of the neck, but most often in the back of head and the top of head or between the forehead and the nose. A lumpectomy is a fatty mass under the skin of the child back. It is usually in the middle of the back. The cord's movement is restricted by the lipomas connection with the meninges and the area outside the spinal canal. This condition is called tattered spinal cord and it may have severe consequences.
Another factor is the parental factors. There's a possibility that older fathers may place their offsprings at risk of certain defects. And this concludes our presentation. Thank you everyone for listening, and I hope that you learned something from our report. Thank you and God bless.